Today, we are going to look at a BodyViz brain builder about the skeletal muscle and muscular dystrophy. Muscle tissue is one of the 4 basic tissues. There are 3 types of muscle tissue: smooth, cardiac, and skeletal muscle. All of these muscle types share 4 characteristics in common, which are elasticity, which is the ability of a muscle cell to return to its original length after a contraction; excitability, which is the ability to respond to a stimulus; contractility, which is the ability to actively shorten; and finally, extensibility, which is the ability to contract over a range of resting lengths. This brain builder will concentrate on skeletal muscle. A whole skeletal muscle is composed of many individual muscle fibers. Each muscle fiber is actually a single multinucleated cell. Contraction of these individual muscle fibers ultimately results in the contraction of a whole muscle. Skeletal muscle cells are striated, which are the light and dark bands seen in this microscopic view. The patterns of these cells are due to the arrangement of the contractile proteins, actin and myosin, within each muscle fiber. A larger, more gross view of the anatomy of the skeletal muscle shows 3 concentric layers: the epimysium, which surrounds the entire muscle; the paramysium, which divides the muscle into smaller compartments called fascicles; and the endomysium, which surrounds each individual skeletal muscle fiber. At the end of each skeletal muscle, the connective tissue fibers of each layer taper and form a tendon, which attaches the muscle to another muscle or to skin, cartilage, or bone. Each skeletal muscle has at least one origin, which is the less movable attachment, and at least one insertion, which is the more movable attachment. Skeletal muscles are grouped into 4 categories, depending on the type of action they are performing. Let's learn more about these 4 categories. An agonist, or prime mover. Contraction of this type of muscle produces the desired movement. An antagonist. Contraction opposes the action of the agonist muscle. A synergist. Contraction of this type of muscle assists the agonist in its production of the desired movement. And finally, a fixator. Simultaneous contraction of an agonist and antagonist stabilizes a joint of the body and produces a stable or immovable base. Muscular dystrophy is a group of diseases caused by one or more genetic mutations that prevent the normal formation and development of one or more proteins needed to make skeletal muscle function properly. Next, we will look at the symptoms, causes, and treatments for muscular dystrophy, and finally give a patient example. The main symptom of muscular dystrophy is progressive skeletal muscle weakness. Specific signs and symptoms develop at different ages, depending on the type of muscular dystrophy. There are approximately 30 forms of muscular dystrophy. Duchenne muscular dystrophy is the most common. Some symptoms, which begin in early childhood, include frequent falls, difficulty rising from a lying or sitting position, difficulty running or jumping, walking on one's toes, muscle pain and stiffness, and delayed growth. Becker muscular dystrophy has symptoms very similar to those of Duchenne muscular dystrophy. However, this form develops later in life and progresses more slowly. The cause for muscular dystrophy is when one of the genes involved in making protein fibers is defective. The type of gene that is defective or mutated relates to the type of muscular dystrophy caused. Most of these defects in the genes are inherited. There is no cure for any form of muscular dystrophy, yet. However, there are treatments for some forms of the disease that can help extend mobility and the heart and lung muscle strength. Medications, therapy, and surgery can sometimes be used. Finally, let's take a look at a patient example. You are an orthopedic surgeon and receive your patient's file and take a look. Age, 25. Gender, male. History, diagnosed with Duchenne muscular dystrophy at the age of 3. Your patient is visiting to consult with you about any possible surgical treatments that could minimize or eliminate the significant contractures he experiences in both of his feet. Tendon release surgery is a possible option, but you want to do some more research on the outcome of the procedure with muscular dystrophy patients. Tendon release surgery is a procedure that involves cutting through or disconnecting a tendon to allow for a greater range of movement. A couple weeks later, after some research, you believe that the procedure could be beneficial for your patient. Your patient comes in to discuss the surgery more in depth and see if the patient is willing to attempt the surgery that may provide only temporary or minimal relief. The patient believes it is worth a shot, and a month later, the surgery is performed. This is a classic example of muscular dystrophy. Would you like to see more 3D anatomy videos like this one? Like this video and subscribe to our BodyViz channel.